Hi there. Right. So, folks, we're really running a little bit late, and I was going to show you a couple of videos to illustrate what people have been talking about, but I only have time to show you one quick one, which was kind of referred to by Jim, which is about how a primary care practice in inner London, the city, um, is tackling health in a wider sense than just giving people medicine. Now, two things about this. One is this is a GP practice. Now, for those of you who don't know what that means, general practitioners in England are primary care physicians. So we talk about GPs, we mean primary care. And secondly, I apologize for this video. I think it's really nice little video, but it's actually taken from Facebook. So we couldn't get rid of some of the the stuff that goes along with it. But anyway, I'm sharing my screen now.
The Lambeth GP Food Co-op is a community-led cooperative of patients, doctors, nurses and Lambeth residents who grow food together. We work in partnership with GPs across the borough, building gardens in GP surgeries and developing unused spaces for food growing purposes. We have built 11 food growing gardens in GP surgeries where patients are actively involved in growing food together, including a garden in King's College Hospital, where we have a monthly stall selling patient-grown food. We were awarded the Best Sustainable Food Initiative in the NHS by Public Health England and the NHS Sustainability Unit.
It got started from a conversation with GPs, patients and nurses located in Lambeth, who were interested in whether we could create a network of food growing gardens across general practice in Lambeth. We were fortunate enough to attract support from Lambeth Council. We also have a very forward-looking and visionary clinical commissioning group in Lambeth, who also funded us to get the Lambeth GP Food Co-op up and running. We have a community across the borough who are involved in different activities interlinked around food, diet and nutrition. The aim of this project is to influence food procurement. It's one of the aims in the NHS. We have 60 hospitals in the M25 corridor. Not one of them buys anything grown locally. We're looking at this one as having an economic context as well as a therapeutic context.
Being part of the food co-op is part of a much bigger ambition that we have, which is really trying to melt away the walls of the surgery and become a much more open building or place for the community where they can come and have access to health and well-being.
The kind of patients that I recommend coming to the garden are people who may be a little bit isolated, maybe they have depression, low mood, other mental health problems that make it difficult for them to get out.
Those with long-term conditions or who are socially isolated, or anybody actually who is interested in keeping fit in another way and meeting other people in the group.
But there you go. I'm just giving you one little example. We can maybe talk to you on the chat or afterwards about how we could share some of those other really quite heartwarming examples of how people are stepping outside of the medical model.